day, my name is Susan Dickens, and today I'm here to talk to you about the non-VA care program through the Department of Veterans Affairs. It's been my experience that the majority of students who attend Park University are affiliated with the military in one way or another, whether they be active duty, prior service, or spouses or family members of veterans. The VA has a motto: it's serving those who have served, and finding a way to be able to serve those veterans who are seen outside of the VA under non-VA care is through the non-VA care program. A recent publication of a book called Best Care Anywhere by Philip Longman, he stated that it may be somewhat ironic that through the Veterans Health Administration, the United States has implemented a model of integrated public sector health care that appears to be on balance and to work well. I personally work for the Department of Veterans Affairs. I work in the non-VA care office, and I process and adjudicate claims for veterans for possible payment or denial. Today I want to talk to you about the non-VA care program and its purpose and who's eligible, the difference between the benefit and an insurance plan, and why it's important that veterans know that this program is available to them. The purpose of the program is simple. In recent years, it has been used to meet patient care needs and standards for patient wait times, and to service veterans who are seen outside of the VA under emergency circumstances. In 2005, or since 2005, the expenditures for the fee care program have grown over 275%. And in the last year alone, the VA serviced over 100 million veterans who were seen in community care. The program was created to overcome barriers for veterans who are in rural communities who cannot get to the local VA facilities for their medical care. The eligibility requirements are governed by the government, they're regulated by the government, and they are standard across the board. All VA medical centers have a fee-based program or a non-VA care program. The first way that you are eligible for this program is under a pre-authorization. The pre-authorizations are put in by the veteran, by the primary care of the veteran for services, for a consult, to be seen outside of the VA for either specialty services, too long of wait times between appointments, or for, like I said, emergencies. The second way is, like I said, emergencies or inpatient stays where a veteran is taken by ambulance or emergency medical services to another hospital. Now that I kind of discuss a little bit what the program is and how you're eligible for the program, I want to talk a little bit about the difference between a benefit and an insurance plan. Today, most of the veterans carry Medicare A and B, some kind of Medicare Advantage plan, TRICARE plans, and some Blue Cross Blue Shield medical insurance plans. With those plans, veterans are subject to copays. They're subject to payment after the insurance company has paid. They're subject to pay whatever is left over. And the positive is that their family members are covered under these insurance plans. And while the Veterans Administration recommends that veterans carry their own private insurance, the difference is that the non-VA care program is a benefit strictly to the veteran. Their family members are not covered under this program. The other benefit is that the claims, when submitted to the VA and are approved for payment, they are 100% payment in full. The veteran is not responsible for any copays, and the veteran is not responsible for anything that the VA does not pay. The vendors have an agreement with the federal government that they will not go after the veteran for any services that we did not pay for. And furthermore, just in addition to that, the VA does not process or even consider claims that are for co-payments. We only consider a claim payment, or consider a full claim for payment. Since we've talked a little bit about the benefits and the difference between benefits and insurance companies, I want to talk to you about why this is important for veterans to know that this program is available to them. A hypothetical situation. Say that a veteran is seen outside of the VA and they are taken by ambulance to a hospital other than, like I said, the VA. If they are taken under emergency circumstances for something that is a service-connected disability and they have other insurance, the likelihood of the Veterans Administration paying that claim is much higher. If a veteran is taken to a facility outside of the VA, also taken by EMS, and they are a non-service connected veteran, and they have no insurance and no other means of paying for these claims, their claims are also considered for payment, or considered possibly for payment under the adjudication process. To get you a little bit better idea of what the non-VA purchase care program is, the Veterans Administration provides a guidebook to the veterans, giving them basically what the emergency medical care means, how the claims are processed and adjudicated, which are done through a UR clinical review process. It also goes over frequently asked questions, why the process for the non-VCC, which is the non-VA care coordination program and referral, how they do that through their primary care provider and get the consult to be seen outside of the VA. This is a wonderful tool for veterans to be able to know and to use. These pamphlets and these brochures are available through the Veterans Administration online at your local VAs. If you just go to www.va.gov, you will be able to pull these programs and these information up. Moving on, the non-VA care for veterans who are non-service connected has become in the recent years more noticed. According to the National Coalition for Homeless Vets, about 13% of adult veterans are homeless, which is why the VA has made such a big push for the non-VA care program. With this statistic in mind, they want to know that their veterans who receive medical care through the VA are going to be covered also. Those who cannot receive medical insurance, those who cannot afford medical insurance, are still going to be covered by the VA under what we call the Millennium Bill program. That program was implemented in November of 2000, specifically to care for non-service connected veterans who do not have the means of paying for their medical bills and are seen outside of the VA under emergency circumstances or inpatient visits. Now that we talked a little bit about the importance of why it's important that veterans know that this program is available to them, I'd like to close with you and say thank you for your time. A little bit that we talked about was the eligibility and benefits, the reason that, or the difference between the benefits in an insurance plan, and the reason that it's important to veterans to know that this program is available. The VA lives off their motto, serving those who serve. That was originated by President Lincoln in his inaugural address in 1865, his second inaugural address in 1865. He stated that with malice towards none, with charity for all, and with firmness in the right as God gives us to see the right, let us strive to finish the work we are in, and to bind with the nation's wounds, to care for him who shall have borne the battle, and for his widow and for his orphan. With those words, President Lincoln affirmed that the government's delegation to care for those veterans who were injured would continue. That regardless of their service, that the Veterans Administration will be there to serve those veterans who have served. And the non-VA care program is specifically that. It's serving veterans who are unable to get to the VA, but who are still veterans and who still deserve the service. That is all that I have for you today. If you have any questions, please feel free to contact me and I would be happy to oblige. Thank you for your time and have a good day.